Hello students, in my continuation of the anterior triangle lecture, today we will discuss the carotid triangle. As I already told you that anterior triangle subdivided into the four triangles, that is the submental triangle, digastric triangle, muscular triangle and carotid triangle. So out of these four, carotid triangle is most commonly asked question in exam. So when you will see the side of the neck, you know that this side of the neck has been divided into the two parts by this sternocleidomastoid muscle, and anterior to the anterior border of sternocleidomastoid, you are going to read the anterior triangle. So this is the area of anterior triangle, and in this anterior triangle, today we are discussing the carotid triangle which lies here. Clear? So this is the most important part of your anterior triangle. So what are the boundaries of carotid triangle? So whenever you are having the boundaries, you will have the front and above. That means this is the front and above. Then you will have the front and below. So this is the front and below. So you will find that anteriorly you will have the upper border and you will have the lower border. Now in this upper border you are able to see a muscle is known as digastric. Now here you can see that this digastric muscle is having the two part. This is the posterior belly of digastric and this is the anterior belly of digastric. And both the bellies are interconnected at one point on the hyoid bone. So in this carotid triangle, we are dealing with the lower border of the posterior belly of digastric. Now anteriorly and below, you will have this muscle which is known as superior belly of omohyoid. And then you will have posteriorly the anterior border of sternocleidomastoid. So my dear students, again you have to understand that this posterior border of sternocleidomastoid majorly forming the boundary of carotid triangle in its all subdivisions. Clear? Now, what are the structures formed in the roof of carotid triangle? So in my anterior triangle lecture, I already told you that roof is formed by the skin superficial fascia, platysma and deep fascia. And deep fascia here is known as investing layer. So these are the important things which you have to understand. And apart from the platysma, in subcutaneous layer you will find some nerves like cervical branch of the facial nerve and transverse cutaneous nerve. Now in this image you can see that this is your platysma, and this platysma is a subcutaneous muscle, and these are the muscles which lies just outside the deep fascia below the subcutaneous layer. Now the most important concept is about the floor of carotid triangle. So my dear students, you have to understand that when you are dissecting below this posterior belly of the digastric, now in this area you will find four muscles. Now before that you have to mark the bones first. So this is your hyoid bone. Clear? Now on the hyoid bone you can see that there is a presence of the intermediate tendon of the digastric. Now we'll see that in this area you will find the four muscles which are forming the floor of carotid triangle. First is hypoglossal. So from the hyoid bone this muscle is arising and this muscle is going towards the tongue, and tongue lies deep to the mandible. So this muscle is going towards the tongue and this muscle is arising from the hyoid bone. So this is become the first muscle is hypoglossal. Now below the hypoglossal you will have one more muscle, and this muscle is connecting this hyoid bone to the thyroid cartilage. So this is known as thyrohyoid muscle. This is the thyrohyoid muscle, and along with the thyrohyoid muscle, this gap is filled by a membrane is known as thyrohyoid membrane. So which are the two muscles I just told you? This is the hypoglossal and this is the thyrohyoid. Now when you will go behind, you will find the constrictors of the pharynx. So this is the pharynx. Now where you will find the constrictor? So this is the one constrictor which is visible here. Now this is your middle constrictor and this is your inferior constrictor. Clear? So in such way you will find the four muscles which are forming the different floor of your carotid triangle. What are these four muscles? So this is the first muscle. What is the name? Is hypoglossal. Then below the hyoid bone, this is the second muscle which is connecting it with the thyroid cartilage. So it is known as thyrohyoid. Then you will have the two constrictors of your pharynx. This is the middle constrictor and this is your inferior constrictor of pharynx. So these four names are very commonly asked in your multiple choice question exams. Now in this part, you can first appreciate that we have removed the vertebral column and the other part. Now you are mainly first appreciate this is the hyoid bone. Now first you are able to see that this is your hyoid bone. Now below the hyoid bone you are able to see that this is your thyroid cartilage. Clear? And here you are able to appreciate there is a connection between the thyroid cartilage and hyoid bone. So what is this? This is your thyrohyoid muscle. Clear? And this is going above and it will go towards the tongue, and this will become hypoglossal muscle. Clear? So let's see one by one about the orientation of these floor muscles of your carotid triangle. So let's see this video clip. Now first, when you will rotate this area, you are able to see that this hyoid bone is getting the muscle clearly. You can see that it is a connection between the thyroid cartilage and hyoid, and this is a connection between hyoid bone and the tongue. Now what is this connection is known as? This is known as hypoglossal. Now some of the students confuse the hypoglossal with mylohyoid. Now my dear friends, if you will see the mylohyoid comes from the hyoid bone and it will go just along the anterior side of the mandible on mylohyoid line. And if you will see from posterior side, you will find that this mylohyoid muscle overlaps some part of hypoglossal, and there is a clear cut gap is present between the hypoglossal and mylohyoid. So on the lateral side of the hypoglossal, you will find that the anterior part of the hypoglossal overlapped by the posterior part of the mylohyoid. So my dear friends, the mylohyoid is not going to form the floor of your carotid triangle. It is the hypoglossal which is going to form the floor of carotid triangle. Now here you can see that there is a placement of the constrictor. Now these constrictors are superior, middle and inferior constrictor. Superior constrictor is again not the part of your carotid triangle. In the carotid triangle, you are going to deal with these two constrictors, that means the middle constrictor and the inferior constrictor. So in this video clip, now it is very well clear that whenever we are talking about the floor of carotid triangle, this floor of carotid triangle is formed by the four muscles. What are these four muscles? This is the first muscle, which is the hypoglossal. Then you have the thyroid. Then you will have the middle constrictor, and this is the inferior constrictor. So here, if you will mark, now this is your sternocleidomastoid, which is going towards the sternum, and here will be your digastric. So this will be the digastric. So now here you are able to understand that in this area you will have these four muscles. Clear? So there should be no confusion about the floor of carotid triangle. And why I am giving the stress on the floor, because this question is very commonly asked in your exam, that which of the following muscle is not taking part in the formation of the floor of carotid triangle. So these are the four muscles which you have to keep in mind: hypoglossal, thyroid, middle constrictor and inferior constrictor of pharynx. Now we will talk about the contents of carotid triangle. So when you are talking about the contents of the carotid triangle, you will have the artery, you will have the vein, nerves, carotid sheath, lymph nodes and apical part of the parotid gland. So again, when we are talking about the carotid triangle, we are talking below this posterior valley of the digastric, and this is the omohyoid, and this is the anterior border of sternocleidomastoid. So when you will do the dissection in this area, you will find a very big vessel, and that is known as common carotid artery. Now this common carotid bifurcate here, and apart from that you will find very important cranial nerves also. So let's discuss these contents. First is the arteries of your carotid triangle. Now when you are dissecting the carotid triangle, in carotid triangle you will find three arteries. One is the common carotid artery, then you will have internal carotid artery and external carotid artery. Now this internal carotid artery enters inside the cranial cavity through the carotid canal, while external carotid artery remain outside the skull and it terminates inside the parotid gland. So now in this image you can see that this is your common carotid artery, and you can see that this common carotid is bifurcating into the two parts. This is the internal carotid and here is the external carotid artery. Clear? So let's discuss first the common carotid artery. So there are few lines which you always keep in mind in terms of the carotid triangle about the common carotid, that it bifurcates in the triangle at upper border of thyroid cartilage. So this is the first question, that this bifurcation of the common carotid artery, or I can say termination of the common carotid artery, lies at what level? So there may be the two answers. One is the upper border of thyroid cartilage, or second answer may be the intervertebral disc at C3, C4. So the disc between the C3, C4 vertebra or the upper border of thyroid cartilage is the level at which this common carotid artery bifurcate. Now the second thing is that the terminal part lies deep to the posterior belly of digastric and stylohyoid muscle. So when you will see the terminal branches, now this is the very important question to understand, that it is giving two terminal branches. Now here you can see that this is your internal and this is your external carotid artery. Now when you will trace these both branches, you will realize that these branches are going deep to the posterior belly of digastric. Now this question has been asked so many times, that the external and internal carotid arteries lies outside or superficial to the digastric or deep to the digastric. So answer is that these branches lies deep to the posterior belly of digastric, and along with the posterior belly you also have a muscle is known as stylohyoid. Clear? So you should always keep this thing in mind, that once the common carotid bifurcate into the internal and external carotid, these both branches will go deep to the digastric muscle. Now at the bifurcation of the common carotid, you will have two very important short notes. One is the carotid body and carotid sinus. So let's discuss these two special features. So what is carotid sinus? So carotid sinus is a fusiform dilatation. So this is the first thing which you have to keep in mind, that it is a dilatation and it involves the bifurcation of common carotid and internal carotid. That means the carotid sinus is not going to involve your external carotid. So it is a feature of common carotid and it continues with the internal carotid artery. It does not affect the external carotid artery. So in this image, if you will see, this is the common carotid and this is the internal carotid. Now this dilatation at the lower end of internal carotid artery is carotid sinus. Clear? So it is a carotid sinus. So this is the first thing which you have to locate, that what is the position of carotid sinus. So carotid sinus present at the beginning of internal carotid artery and also present in the terminal part of common carotid. It has no relation with the external carotid artery. The next thing is that what is the characteristic feature of the wall of sinus. Now if you will see the wall of the carotid sinus, it is different from the normal arterial wall. How? It is thinner and it is more elastic. Now this is the characteristic feature which you have to write down in your short note, that carotid sinus wall is having a characteristic feature. It is thinner as compared to arteries elsewhere, as well as it is more elastic. That means it has a expansile nature more than in a normal artery. Now apart from that, this area is supplied by three nerves. Now this is the important thing. What are these three nerves? You have the sinus branch of glossopharyngeal nerve, you have the branch of vagus nerve, and you have the branch of sympathetic system. So these are the three nerves which are supplying this carotid sinus. So sinus branch of glossopharyngeal, that is the 9th cranial nerve, branch of the vagus, and sympathetic supply is there. Now what is the function of this carotid sinus? So carotid sinus act as a baroreceptor. That means it controls the intracranial blood pressure. Clear? So you know that internal carotid artery enters inside the cranial cavity and it will supply blood inside the cranial cavity. So that's why you are able to connect now that this baroreceptor present at the starting point of internal carotid artery, and with that it is able to control the intracranial blood pressure. So if you will do the stimulation of this carotid sinus, what will happen? Now as soon as the carotid sinus will stimulate, it will decreases the blood pressure. So the blood pressure of that individual will fall, and along with that what will happen, that there is a decrease in the heart rate also. So this is the important thing, is that whenever there is a stimulation of the carotid sinus, it will lead to the hypotension and bradycardia. That means it decreases the blood pressure as well as decreases the heart rate. Clear? Now, there is a sinus syndrome is present. Now, what is this carotid sinus syndrome? Now, carotid sinus syndrome is a abnormality in the sinus. That means in some individuals, you will find that this sinus is very hypersensitive. Now, what do you mean by hypersensitive? In such cases, in these patients, when they rotate their head, and this rotation of the head can be the stimulation of the carotid sinus. Now, if by this rotation of the head, if their carotid sinus is stimulated, what will happen? They will have the decreased blood pressure and decreased heart rate. And this low blood pressure is lead to the sudden attack of syncope. Sudden attack of syncope is there because of the sudden fall in the blood pressure. Clear? And why there is sudden fall of the blood pressure? It is because of the stimulation of this carotid sinus. So, this abnormal syncopal attack in that individual just due to the rotation of head shows that that fellow is having very hypersensitive carotid sinus, and this is known as carotid sinus syndrome. Clear? Now, we will talk about carotid body. Now, carotid body is again a very special feature at the starting point of your internal carotid artery as well as at the termination of common carotid. So, it is a small and oval structure. Now, this is the first difference. What is the carotid sinus? Carotid sinus is a modification in the wall of artery and it is a fusiform shape. What is carotid body? Carotid body is a oval shaped structure and it is situated on the wall of carotid sinus. Clear? That means it is a feature which is present here. Now, see, this is the dilatation. Now, what is this dilatation is known as? The dilatation is known as carotid sinus. Now, on this sinus, you can see that this pink color small nodule is placed. Now, this nodule is known as carotid body. So, you have to keep the difference in sinus and body in your mind. And this body lies on the outer wall of carotid sinus. Now, this is a neurovascular structure, and this neurovascular structure also receives the nerve supply from three sources. One is the glossopharyngeal nerve, vagus nerve, and sympathetic supply. Now, what is the effect of this nodule? The effect of this nodule is that this nodule acts as a chemoreceptor. So, now this is the sinus and this is the body. The sinus is your baroreceptor. Sinus is a baroreceptor and this body is a chemoreceptor. So, there should be no confusion. You can keep this thing in mind that B is not for B. B is not for B. That means body is not a baroreceptor. Body is a chemoreceptor. Sinus is a baroreceptor. So, this is a very commonly asked question, which of the following is a chemoreceptor or baroreceptor? So, B is not the B. That means body is not the baroreceptor. Body is chemoreceptor, sinus is baroreceptor. The another important thing about the carotid body, that carotid body monitors the oxygen tension in the artery. Clear? So, it monitors the oxygen tension in artery. So, the carotid body is stimulated if by the anoxia, then what will happen, that the reflex is that it rises the blood pressure and heart rate. So, it increases the blood pressure and it increases the heart rate, and along with that it increases the depth of respiration as well as the rate of respiration. So, here you have to understand that what is the stimulating factor for the carotid body? Answer is anoxia. That means when the oxygen concentration decreases in the body, at that time this carotid body increases your depth of respiration and rate of respiration. So, what is the effect? That you will clear the carbon dioxide in your body and you will get more and more oxygen inside. And for that you need increased blood pressure and heart rate and increased depth as well as rate of respiration. So, that effect is possible by the stimulation of the carotid body. Now, there is some abnormal enlargement of carotid body occurs if this pink color area enlarges abnormally, then it is going to known as potato tumor. So what is potato tumor? Potato tumor is the tumor or enlargement of this carotid body, and if the carotid body enlarges, it produces the pressure on underlying carotid sinus. So this is the sinus. So if the pressure will come on the carotid sinus, what will happen? The effect of carotid sinus stimulation are seen. That means it will lead to the bradycardia, it will lead to the hypotension, and in such condition patient will have the fainting attacks. Clear? So these are the two very important questions. One is carotid sinus and carotid body. Now we'll talk about the another content of carotid triangle, that means external carotid artery. Now when you will see the external carotid artery, I already told you that external carotid artery arises at the upper border of the lamina of thyroid cartilage and it remains outside. Now here the important thing is that you can see that this carotid artery, external carotid artery, lies deep to the posterior belly of the digastric, and in this triangle, when we will talk about in the carotid triangle, it will give 5 branches. Now this is the most commonly asked question in exam. There are total 8 branches of external carotid artery. Out of the 8, the 5 will arises inside this carotid triangle. So what are these 5 branches? Ascending pharyngeal artery, superior thyroid artery, lingual artery, facial artery and occipital artery. Now here you can see that this is the occipital artery. Now this occipital artery is going posteriorly and it is supplying this part of the scalp. Apart from that, if you will see the other artery, you will find that facial artery is also visible here. Now this is the facial artery which is coming on the face. Now this is the lingual artery which is going towards the tongue. This is your ascending pharyngeal artery. So you will find that out of the 8 arteries, the 5 will arises in the carotid triangle, which is a question of your exam. Now if you will see again the common carotid, external and internal carotid. Now this is what you are seeing from the inner side. Now this is my triangle of my left side, but you are seeing this left side from this view. Now you are seeing the inner side where you can appreciate that this is the common carotid and this is your external carotid and this is your internal carotid artery. So these lies deep to this posterior belly of digastric. Now here in this image you can see different branches of external carotid, and you have to keep this thing in mind that as the external carotid itself lies deep to the posterior belly of digastric. So whatever the arteries are arising from the external carotid in upper part, they arises deep to this posterior belly of digastric. Now the next content is the vein. Now when we will talk about the veins of the carotid triangle, the most and largest vein is your internal jugular vein. So you know that internal jugular vein form here in the jugular canal by continuation of sigmoid sinus. Now this jugular vein is running downward, and you have to understand that this vein is again lies behind this posterior belly of digastric, and then it is going vertically downward deep to the sternocleidomastoid, and ultimately it enters into the upper part of the chest. Now here in this area it receives the tributaries. Now here you can see that this tributary is coming from the face, so it is the facial vein. Apart from the facial vein, it also receives the pharyngeal vein, lingual vein and superior thyroid vein. So in term of the venous part of the content of carotid triangle, you will have the internal jugular vein. Now there are few important cranial nerves are also seen in the carotid triangle. Now this is again the question of your exam, which of the following nerves are visible in the carotid triangle. So first of all is the vagus nerve, then you will have the superior laryngeal branch of the vagus nerve, then you will have spinal accessory nerve, then you will have the hypoglossal nerve, and you will have the upper root of the hypoglossal which is going to form the Ansa cervicalis, and lastly the sympathetic chain. So you will have the 10th cranial nerve, you will have 11th cranial nerve, and you will have the 12th cranial nerve. So when you are talking about the carotid triangle, you will find lower 3 nerve 10, 11 and 12 along with the sympathetic chain. Clear? So let's see these nerves one by one. First is the spinal accessory. Now spinal accessory nerve is present only in the upper part of your triangle near the apex, where it disappears deep to the sternocleidomastoid. So in this image, I will tell you where is the nerve. So now you will find out that this is the small area of the nerve. Now this small area is the spinal accessory. Now you know that there is a jugular foramen. Through this you have the exit of spinal accessory. Now this spinal accessory is going here deep to the digastric, then it will appear in this part of the apex of your carotid triangle and immediately it will disappear. Here you can see it is deep to the sternocleidomastoid. Then you will have the vagus nerve. Now the vagus nerve runs in the carotid sheath. Now you know that there is a envelope of the deep fascia and this envelope is known as carotid sheath. Now in this carotid sheath you will have the three structure. You will have the internal jugular vein, you will have the internal carotid artery and you will have the vagus nerve. So this vagus nerve is coming out from the jugular foramen, it is running vertically. So when you will see the carotid triangle, again we are talking below this digastric. So in this area you will find that there is a vagus nerve which is present in the carotid sheath and here it gives a branch is known as superior laryngeal nerve. So this is the superior laryngeal nerve. Now this superior laryngeal nerve may sometimes have higher origin or it may come out from the upper part of carotid triangle. And this superior laryngeal divide into the internal and external laryngeal nerves. Now we will talk about the hypoglossal nerve. Now this hypoglossal nerve comes out from the hypoglossal canal, that is known as anterior condylar canal. Now this nerve runs superficially on the external and internal carotid arteries in carotid triangle. Now this is the question which has been asked so many times in exam. Which of the following nerve lies on outer side of internal and external carotid artery? So here you can see that this is your two arteries, this is one artery and this is the external carotid. Now here is the nerve. So nerve is crossing the superficial area of these arteries. So this is the first important thing. Second thing is that now you have to understand here that there is a one artery arising from the external carotid. Now this is the lingual artery. You can see the origin of lingual artery and this origin is making a loop. Clear? Now when you will see this loop is identified in the dissection just by the relation with hypoglossal nerve. So you will find here that this is the nerve and this nerve is crossing the loop superficially. So what is this loop? Now this is the loop. Now this loop is of lingual artery and on outer side of the loop what you will have? Hypoglossal nerve. So you have to keep this point also in your mind that how to identify the lingual artery in dissection. Answer is by this hypoglossal nerve, or the vice versa. How to identify hypoglossal nerve? Answer is that it lies on the loop of lingual artery. So this loop of lingual artery is a very important landmark during the dissection and it is also a question on the diagram based exams where you have to identify the lingual artery. So you have to just follow the hypoglossal nerve and if it is crossing any loop which is coming from the external carotid, then artery has to be lingual artery. Or if this lingual artery is crossed, the loop is crossed by any nerve, then the nerve has to be hypoglossal nerve. Now ultimately when you will go anteriorly, this nerve will enter into the gap between the mylohyoid muscle and hyoglossus. Now this hypoglossal nerve will give a loop. Now this is a lower loop, that means the extension like this. Clear? Now this loop is known as Ansa cervicalis, which is having two parts. Now there is a one part comes from the hypoglossal nerve. So that part is known as upper root, or it is known as descendens hypoglossy, or it is known as Ansa hypoglossy. So what is Ansa hypoglossy or descendens hypoglossy? Ansa hypoglossy or descendens hypoglossy is the part of the loop which is coming here. Now here you can see that this is the anterior condylar foramen from which the nerve is coming out, that is the hypoglossal nerve. Now this hypoglossal nerve is going like this into the tongue. But here it is also giving one branch which you can see going downward and vertically. Now this downward and vertical branch of the hypoglossal nerve is nothing but it is a part of Ansa cervicalis which is known as Ansa hypoglossy. And this part of Ansa cervicalis or Ansa hypoglossy supply the superior belly of armohyoid, and this Ansa cervicalis lies on the anterior wall of carotid sheath. Now, apart from that, you will have the carotid sheath inside. So, I already told you carotid sheath, and for detailed of the carotid sheath, you can watch my video on the carotid sheath. Then you will have the lymph nodes. Now, lymph nodes are also very important content of the carotid triangle. Now, here in this carotid triangle, below this area, you will have the deep group of lymph nodes, and these deep group of lymph nodes always present along the internal jugular vein. So, this is the question, that where will you find the lymph nodes? Answer is along the internal jugular vein, and they have divided into the two groups. One is known as jugulodigastric group of lymph node, another is known as jugulo-omohyoid group of lymph node. So, jugulodigastric lymph node lies below the posterior belly of digastric. So, this is the posterior belly of digastric, and here you will have the lymph node which are known as jugulodigastric. Then you will have jugulo-omohyoid, which lies above the inferior belly of omohyoid. So, they will lie in the lower part of your triangle. Clear? So, whenever you are reading the lymph node, which lymph nodes you are present, you will find deep lymph nodes, and which deep lymph nodes? Jugulodigastric and jugulo-omohyoid. Now, sometimes you will find the apex of the parotid gland in carotid triangle. So, when you will see the carotid triangle, you know that carotid triangle is here. Now, in this carotid triangle, posteriorly you will find this lower part of the apex of parotid gland, and this part of the parotid gland is also overlapping the posterior belly of digastric. Clear? So, now at the end of this lecture of the carotid triangle, what you are able to understand, that carotid triangle is having a very important structure is known as common carotid artery. Common carotid artery bifurcates at this level in the external and internal carotid artery. The beginning of internal carotid artery show the special characters like carotid body and carotid sinus. Apart from that, you have seen that this triangle also have the veins. It is having the lower 3 cranial nerves, it have the lymph nodes as well as the apical part of parotid gland. So, this is all for the carotid triangle. Thank you.